The number of people walking around with a pot belly has skyrocketed in just the last decade. Many people seem to ignore it, and those who do worry often keep postponing action. Experts call the pot belly a ticking time bomb because behind it often hides type 2 diabetes, high blood pressure, fatty liver disease, heart disease, and even certain cancers. So let's uncover what really causes a pot belly and, more importantly, how to get rid of it.
Hello, this is Trilok. I'm a dietitian. Today we will talk about the pot belly. It can come from many directions: your genetics, your food, your lifestyle, and even your gut. So let's break down what a pot belly really is, the factors that cause it, and most importantly, how to get rid of it. So let's begin by understanding how a pot belly develops.
Think of the belly in layers. First, there is the skin, then subcutaneous fat, the main storage site for fat, then the abdominal muscles, your abs, then the omentum, a fatty apron covering the intestines. After that, there is mesentery, the tissue that supplies blood to the intestines. And finally, after all the layers, you have the intestines. When you gain fat, the subcutaneous layer thickens first. After a certain point, fat starts spilling into the visceral space. The omentum and mesentery thicken, the liver becomes fatty, and even the pancreas can start accumulating fat. Every person carries about 1 kilo of visceral fat, and that's normal. But once it grows beyond this, it becomes a problem. Now, here is where genetics make a difference. The capacity to store fat under the skin is much higher in Caucasians compared to South Asians. Imagine this: Caucasians have a bigger tank under the skin to store fat, spread across all over the body. But in South Asians, the tank is smaller. Once it fills up, even at a BMI of just 24, the excess fat begins to spill into the abdominal region and surrounding organs. Caucasians, on the other hand, may not start accumulating visceral fat until a BMI closer to 30. So, when Caucasians gain weight, they tend to spread fat more uniformly across the body. But South Asians, including Indians, grow a belly disproportionately to the rest of the body. This is known as the thin fat Indian phenotype. And here is why that matters. Once the liver becomes fatty, it stops responding properly to insulin signals. This is the central issue in type 2 diabetes, insulin resistance. Today, at least 10 crore Indians are living with insulin resistance, whether diagnosed with diabetes or pre-diabetes. And in almost all of them, insulin resistance is the driving force. If your diabetes duration is less than 5 years and you lose visceral fat to a point where insulin resistance is reversed, you have a 70 to 80% chance of achieving diabetes remission. But if your diabetes duration is more than 5 years, the chances of remission fall to 50 to 60%. So, the longer you delay, the harder it is to control diabetes. And it doesn't stop there. Visceral fat, especially fatty liver, not only drives insulin resistance and diabetes, it also raises cholesterol and triglyceride levels. Together with the damage from excess blood sugar to the arteries, you have a deadly combination that explains why diabetes and heart disease so often go hand in hand. Central obesity is also a major cause of non-alcoholic fatty liver disease, which can progress to liver cirrhosis. The risk of colorectal cancer, pancreatic cancer, breast cancer in postmenopausal women, and possibly prostate and liver cancers also goes up. And beyond that, central obesity can trigger obstructive sleep apnea, chronic kidney disease, polycystic ovary syndrome in women, and low testosterone in men. So a pot belly isn't just cosmetic, it is a ticking time bomb. What exactly causes it is not just your genetics. There are clear lifestyle and dietary factors at play, and we will go through them one by one, starting with the ones that has the highest impact. And the first factor which has the highest impact is consumption of high calorie and ultra processed foods. These are usually made from refined carbs but loaded with sugar and oil. All deep fried foods like samosa, puri, french fries, or even simply using too much oil in cooking. Yes, it makes food tastier, but it also adds a huge calorie load. Then comes foods high in both sugar and fat, such as chocolates, ice cream, pastries, most bakery items, and of course, packaged snacks, instant noodles, chips, and Indian savories like save and mixture. All of these are calorie bombs that directly fuel belly fat.
And studies confirm this. People who consume fried food more frequently have a 25 to 30% higher risk of developing abdominal obesity. And national data shows that more than 50% of adults in India have abdominal obesity, even when many are not obese by BMI. So, moving on to the next factor that has the second highest impact on developing a pot belly is a lack of physical activity.
An ICMR study covering 14,000 adults found that 54% of Indians are inactive and fewer than 10% meet the WHO recommendation, which is just 30 minutes of cardio a day, 5 days a week, plus some muscle strengthening exercise. In India, sports participation drops sharply after school and college going age due to long working hours, lack of facilities, and the belief that sports are only for the young.
On top of this, Indian adults spend 4 to 5 hours daily on screens outside of their work, mostly scrolling social media. So, when you combine low activity with a sedentary lifestyle, the result is obvious: central obesity and belly fat. Moving on, the next factor is refined carbohydrates.
Diets that are heavy in white rice, maida, and refined wheat are a big driver. These carbs are stripped of fiber, protein, and vital nutrients. They don't trigger satiety, so we tend to overeat. They cause rapid glucose spikes, leading to rapid insulin secretion. With less muscle mass, South Asians can't store all the glucose in muscle, so it is converted into fat and stored in the body.
Factor 4 is alcohol and beer consumption, which can lead to fatty liver and more visceral fat. Factor 5 is hormones.
Stress and post sleep rise cortisol levels, the stress hormone, which drives belly fat storage. Hypothyroidism slows calorie burning, which can lead to weight gain and belly fat. In women, menopause shifts fat deposition from hips to belly. In men, low testosterone fuels central obesity.
Factor 6 is poor gut health. Most of us don't consume enough fiber, and combined with a sedentary lifestyle, it can cause constipation, poor bowel patterns, and an imbalance between beneficial and harmful gut bacteria, which can trigger bacterial overgrowth, leading to gas and bloating.
When gas builds up inside the 25-foot long intestines, it pushes the belly outward, making the pot belly look worse even if it's not all fat.
Other contributing factors include poor sleep, late night eating, smoking, and chronic stress. So, how do we get rid of the pot belly? As a dietitian, I'll show you clear steps that can help reduce the pot belly.
Cut down excess calories from junk foods. Avoid high calorie foods that are loaded with fat and sugar. Things like cheese, mayonnaise, ice cream, bakery items, deep fried foods, packaged snacks, instant noodles, sweets, and sugary drinks. Limit alcohol and beer consumption and reduce oil usage in cooking. This way, you cut out excess calories from refined carbs and unhealthy fats. Let's say you ate 4 idlis. They digest fast, rise blood sugar quickly, and lead to insulin spikes. But if you eat a salad and protein first, the digestion slows down. The food enters the small intestine slowly. Glucose is absorbed gradually and insulin spikes are lower. Studies by Dr. Alexander Jenkins and colleagues showed adding fiber reduced post-meal glucose spikes by 30 to 40% and improved satiety. Your pre-meal salad could be as simple as 40 grams cucumber, 30 grams carrot, 20 grams tomatoes, and 50 grams of boiled sprouts. So choose healthy carbs like steel-cut oats, brown rice, or millets and pair them with protein-rich beans, lentils, dals, or egg whites, and a small plate of salad. Improve your gut health. Have a plate of raw or lightly steamed vegetables daily. Cucumber, carrot, bell peppers, tomatoes, beans, pods, and fruits. Combined with good hydration, this fiber helps regulate bowel movements and reduce gas and bloating. Add seeds like flax or chia seeds for an easy fiber boost. If you still have irregular digestion, consider taking a fiber and a probiotic supplement under your doctor's advice. Stress management. Stress raises cortisol, which promotes belly fat. Reassess your priorities. Don't try to handle everything at once. Try meditation, it definitely helps. And don't fall into the thought loop or ruminative thinking. And seek professional help if needed. You can also check out my mental health video series for practical tips. Exercise. If you have been sedentary, start slow but start. Build a routine of exercise or sports, at least 40 minutes every day, and stay consistent. With 1 to 2 months of regular activity, you will begin to see visible changes. Check your hormones. Get some basic blood tests done, including a thyroid profile. If there is an imbalance, consult your doctor and correct it, because often untreated hypothyroidism is a reason for central obesity and belly fat.
So don't let the pot belly take control of your health or your life. Losing even 5 kilos can make a huge difference to your blood sugar, your liver, and your heart. Start today. Talk to your dietitian, work with a trainer, start making small but sustainable changes. I know it is very difficult to change a habit, but health has to be one of your top priorities. Because every step you take, every kilo you lose, helps diffuse the ticking time bomb. I hope this video helped you. Please give it a like, share it with someone who needs it, and subscribe for more science-backed nutrition content. Thank you for watching Nutritional Perspective. I'll see you in the next video.